Fanconi Syndrome. Fanconi Syndrome, autosomal recessive disease, cause musculoskeletal abnormality, growth retardation, short stature. Patient has hearing loss, pounding sensation in the air, microcephaly, hypogonad, microphthalmia, absent thumb, short stature, horseshoe kidney. Fanconi syndrome, autosomal recessive disease, cause bone marrow failure. Patient show aplastic anemia, bleeding gum due to thrombocytopenia, fatigue due to anemia. Fanconi syndrome, autosomal recessive disease, cause cutaneous abnormality. Patient has generalized hyperpigmentation in the skin, cave outlet spot, large freckle. Eye, ear, strabismus, deafness, recurrent infection. Child could have chronic hemorrhage or conduction defect in the ear, which could cause the pounding sensation in the ear. Disease show around the age of 15th, mean corpuscular volume greater than 100, macrocytic anemia, hemoglobin hematocrit low, reticulocyte count low, low red blood cell, low white blood cell, pancytopenia, platelet low, bone marrow biopsy aspiration, hypocellular. Cytogenetic analysis, breakdown of the chromosome due to defect in DNA repair, may cause increased serum diphosphobutane. Treatment for low hemoglobin hematocrit, transfuse blood, give defuroxamine to prevent iron deposition in the body, antibiotic prophylactically due to low white blood cell, give androgen, corticosteroid. If it doesn't improve, bone marrow transplantation for aplastic anemia. Hematopoietic stem cell transplantation will be the cure if possible. Fanconi syndrome patient may develop acute myelogenous leukemia. Differential diagnosis, thymic tumor. Steroid. Athletes bodybuilder use steroid to increase their performance. Affect the use of the steroid, increase hematocrit significantly due to erythropoiesis, increase coagulation, growth problem by premature epiphyseal fusion, decreased testicular function, gynecomastia, cardiac disease due to lower HDL and increased LDL, psychological disturbance, aggressive behavior, hepatotoxicity, virilization in the omen. Hereditary Hemorrhage Telengiectasia, Osler-Weber-Rendu syndrome, autosomal dominant disease, malformation of the venous capillary in the skin and in the mucous membrane, hemorrhage in the skin, oral mucous membrane, recurrent cause of epistaxis, arterial venous malformation in the GI tract, lung, patient could present with hemoptysis. Liver, brain can also has AV shunt. AV shunt in the lung, blood go from the right side of the heart to the left side of the heart without being oxygenated. Patient develop hypoxia, erythropoietin production increase. Patient has erythrocytosis. Patient hematocrit increase. May see ruby color papule in skin and in the mucosa which could bleed in small pressure. This papule could become lens after give the small pressure. Digital clubbing due to hypoxia. No hepatosplenomegaly. CBC. Increase hematocrit significantly. White blood cell platelet are normal. So no pancytopenia. What is telangiectasia? Vascular lesion formed by dilation of a groove of a small blood vessel. Case A. A child has 1 centimeter in diameter, non-tender, rubbery, movable cervical lymph node enlargement but no symptom. What you do next? Our patient could be an adult and present with several non-tender, rubbery, non-tender cervical lymph node which is almost 1 centimeter in size but no hepatosplenomegaly. Lymph node on observation may cause the upper respiratory infection or other infection, and look for other lymph node enlargement. Do the thorough physical examination and look for any hepatosplenomegaly. Infections such as infectious mononucleosis, herpes simplex virus, or bacteria would not give hard or non-tender lymph node. Streptococci and staphylococci cause the fluctuant lymph node enlargement at the neck and head. Infectious mononucleosis can cause the bilateral lymphadenopathy, fever, pharyngitis. If the lymph node is less than 1 centimeter, and patient has more chance to have benign lymphadenopathy. If the child has fever, what do you do next? Give antibiotic. Child could have bacteria, viral, fungal infection. After observation, if patient develop fever, chill, white loose, or the lymph node grow larger, need for further evaluation by excision biopsy. Case B. You observe the patient and lymph node is getting bigger. What will you do next? Biopsy to make sure that patient does not have cancer, breast cancer or granulocytosis, etc. If the node is firm, immobile, and is greater than 2 cm, patient has more chance to have malignant lymphadenopathy. So biopsy is the answer. Case C. If the patient has 1 cm cervical lymph node and patient has fever, chill, night sweat, and white loose, what do you do next? Do the biopsy. Case D. Old person. If the cervical lymph node is greater than 1 centimeter and is firm, hard, and or immobile, what do you do? What would you suspect? Patient may have malignancy like breast or lung cancer or granulomatous disease. Do the biopsy. Case E. If an old patient has history of smoking or complaint of ear pain, and physical exam find the lump at the one side of the neck which is hard and non-tender at the submandibular region or cervical area, patient could have a squamous cell carcinoma at the head or neck region which metastasized to the lymph node. Blood count is normal. Do the biopsy immediately. Hodgkin lymphoma has generalized lymphadenopathy. Leukemia lymphoma would have abnormal blood count. Case F. Sarcoidosis. Sarcoidosis can cause generalized cervical lymphadenopathy. Respond to the steroid. How to give the bad news to the patient. Case like patient has lymph node enlargement and was done excisional biopsy and biopsy report came that patient has cancer. How would you tell this news to the patient? This case for any cancer news. Let patient to sit down in a private room comfortably and quietly. After that, ask the patient what does he think about his symptoms such as lymph node swelling. After that, ask him how much does he is interested to know the condition of his health. Give the patient bad news by saying the results show that you have lymphoma, etc., for example. After that, discuss about the prognosis and the treatment plan. Next, we will talk about the tumor, for example, leukemia.